What if the reason you drift to one side is not simply weak legs or just getting older? That quiet pull when you walk, the hand reaching for a wall, and the hesitation before turning may be your body warning you that its balance system is no longer working efficiently. Ignore it, and your confidence may slowly shrink. Train it correctly, and you may begin to move with greater control again. Today I will explain what may be happening and guide you through 8 gentle exercises using only a wall and a sturdy chair. The routine takes about 12 minutes. But first, walking drift can have many causes: inner ear problems, vision changes, medication side effects, muscle weakness, nerve problems, low blood pressure, or neurological conditions. Neck stiffness may make head movement and orientation harder, but it should not automatically be blamed on reduced blood flow to the brain. New, worsening, or one-sided balance problems require medical assessment. If this content helps you, subscribe and turn on notifications. At the end, comment 1 if the routine was useful or 0 if it was not. Balance is controlled by a team. Your eyes tell your brain where you are. Your inner ear detects movement. Sensors in your muscles and joints report your body's position. The cerebellum combines these signals and makes rapid corrections so that you can stand, turn, and walk smoothly. When one part becomes less reliable, you may sway, shorten your steps, look down constantly, or grab nearby furniture. We will train 2 areas. The first 3 movements gently reduce neck stiffness and improve comfortable head mobility. The next 5 challenge coordination, walking control, and balance. Script 8. Exercise 1. Gentle neck rotation. Sit tall in a sturdy chair. Lower your chin slightly. Slowly turn your head to the right until you feel a mild stretch. Hold for 3 seconds, return to the center, and repeat on the left. Perform 5 repetitions on each side, once in the morning and once in the evening. Keep the movement smooth and pain-free. Never push your head with strong pressure. Script 9. Exercise 2. Side neck stretch. Place your right hand gently over your right collarbone. Tilt your head toward your left shoulder and raise your chin only slightly. You should feel a gentle stretch along the right side of your neck. Hold for 20 to 30 seconds while breathing normally. Return slowly and change sides. Complete 2 holds on each side. Do not pull hard on your head. Script 10. Exercise 3. Gentle self-massage. Using your fingertips, make small circles beneath the base of your skull and down the muscles on both sides of your neck. Avoid pressing over the throat. Spend about 60 seconds on each side. Use light, steady pressure and stop if the massage causes pain, dizziness, nausea, tingling, or visual changes. Now we move to balance training. Stay beside a wall, countertop, or sturdy chair. Script 12. Exercise 4. Slow motion straight line walking. Look forward, not down. Take 1 slow step over 3 or 4 seconds. Lift your foot, pause briefly, place your heel down, and transfer your weight with control. Walk 10 steps forward. Turn using several small steps, then walk 10 steps back. That is 1 set. Complete 3 sets. Mild wobbling is acceptable, but use the wall whenever you need it. As you improve, practice on another firm surface, but avoid loose rugs or unstable flooring. Script 13. Exercise 5. Heel-to-toe walking. Place 1 foot directly in front of the other so that the heel nearly touches the toes. Take 10 controlled steps forward, turn carefully, and take 10 steps back. Complete 2 sets. Keep 1 hand near the wall. When this becomes easy, cross your arms over your chest, but only if you can remain safe and controlled. Script 14. Exercise 6. Standing marches with a cross-body tap. Stand behind a sturdy chair. Lift your right knee and touch it with your left hand. Lower your leg slowly. Then lift your left knee and touch it with your right hand. Complete 10 repetitions on each side. Focus on timing. Your hand and knee should meet at the same moment. Progress from holding the chair with your full hands to using only your fingertips. Eventually, you may briefly release the chair. Do not perform this exercise with your eyes closed unless a qualified physical therapist has assessed you and is supervising the progression. Script 15. Exercise 7. Controlled turning with a visual target. Stand near a wall or countertop and choose a clear point at eye level. Keep looking at that point as you begin a slow turn using small steps. Turn only as far as you can without dizziness, then return to your starting position. Repeat up to 5 times in each direction. A complete 360-degree turn is not necessary at first. The goal is controlled turning, not speed. Stop immediately if the room begins to spin or you feel disoriented. Script 16. Exercise 8. Multi-directional weight shifts. Stand behind a chair with your feet hip-width apart. Shift your weight to the right and lightly lift your left foot for up to 3 seconds. Return to the center and repeat on the other side. Next, shift slightly forward without lifting your heels. Return to the center, then shift slightly backward without lifting your toes. Right, left, forward, and back make 1 complete round. Perform 3 rounds. As you improve, progress from full hand support to fingertips only. Never remove your support before you are ready. Balance exercises and activities that strengthen the legs and core can help reduce fall risk, particularly when they are performed regularly and progressed safely. Here is how to organize the routine. Spend about 5 minutes each morning on the 3 gentle neck movements. Later in the day, practice the 5 balance exercises in short blocks. Consistency matters more than intensity. A few controlled minutes on most days are better than one exhausting session followed by several days of inactivity. Now, the safety rules. Use a stable chair that cannot roll. Clear the floor of rugs, cables, pets, and clutter. Train barefoot only on a clean, non-slip surface. Otherwise, wear supportive shoes with non-slip soles. Never practice these exercises in slippery socks. Do not force your neck or continue through sharp pain, spinning, sudden nausea, blurred or double vision, faintness, chest pain, new numbness, or weakness. Speak with a doctor or physical therapist before beginning if you have Parkinson's disease, a previous stroke, frequent unexplained falls, severe osteoporosis, significant neck instability, known artery disease, recent surgery, or a condition affecting your nerves, eyes, or inner ear. Also ask for a medication and blood pressure review if you often feel unsteady after standing. Sudden drifting is different from a gradual decline. If your imbalance appears suddenly, especially with facial drooping, arm weakness, speech difficulty, a severe headache, double vision, or an inability to walk, seek emergency medical care immediately. Do not expect perfection on day 1. Begin with the gentle neck rotation and the slow motion walk. Add another exercise every few days. Track how often you touch the wall, how smoothly you turn, and how confidently you cross a room. These small improvements matter more than forcing difficult repetitions. Give the routine several weeks of regular, safe practice while addressing any underlying medical cause. Your goal is not to prove that you can balance without support. Your goal is to teach your body to respond more accurately before a small wobble becomes a fall. One final point. Balance training is only one part of fall prevention. Your legs still need enough strength to lift your feet, rise from a chair, and recover from a stumble. That is why the next video focuses on safe leg strengthening exercises for adults over 70, with no gym and no special equipment. Share this video with someone who reaches for the countertop, avoids walking outside, or feels nervous while turning. Comment 1 if this routine helped you or 0 if it did not. Like the video, subscribe to the channel, and continue watching for more practical guidance on staying strong, steady, confident, and independent.